We are live. Hey everybody, Eric Wong here, aka Coachy from Precision Movement with Dr. B, Dr. Aaron Boynton.
Hi everybody.
We are super excited, as always, to be talking to you about movement, recovering from injuries, eliminating pain, and how to get your body set up so that movement longevity is a part of your future. And today, Dr. B is talking about the rhythm of recovery. And this is something that I'm really interested in hearing about. And then after that, we're going to answer some questions. I know there's a bunch of people online right now who might have some questions, whether it's about the topic itself or other questions that they might have that they want Dr. B's opinion on. And we've got some other questions also from the previous live stream that we did last Thursday from Colin, I believe, who's asking about tendons and healing tendons. So I'm really pumped to get Dr. B's insight into this one. So just a reminder to everybody, we're doing these live streams every Thursday at noon. So make sure you subscribe to the channel, hit the little bell there, and you'll get notified of when it comes on. And you can also go over to precisionmovement.coach to sign up for the email newsletter if you want email notifications, and to sign up for the newsletter where there's other info that might benefit you as well. So with that little intro out of the way, I'm going to turn it over to Dr. B, and she's going to guide you through a presentation on the rhythm of recovery.
Well, thanks a lot, Eric. I'm really excited to be here again today, and looking forward to speaking with everybody. Today, we are going to review the rhythm of recovery, a 4-stage strategy for rehabilitation. So last week, we discussed the importance of the performance pyramid and having a solid foundation for movement. One of the keys to maintaining a good foundation for movement is excellent recovery. We have to recover well from our activities in order to maintain this foundation. And the older we are, the more important recovery becomes. In my experience, recovery is probably the most neglected aspect of movement longevity, and is particularly problematic in elite sport or people who work at very strenuous jobs where schedules and productivity prevail. If we overstress our bodies and do not recover, we can get a wear and tear injury, which results in the loss of our foundation for movement. And today we're going to discuss how the body attempts to repair the injury and the variables that we can control in rehabilitation. Eric and I have developed a 4-phase strategy. Sorry, just want to shift my slide here. And oh, here we go. Eric and I have developed a 4-phase strategy to help you through your recovery process. And this involves relaxing the tissues in the first phase to improve the suppleness and ability to rebalance. This is followed by reset, which is reprogramming the neuromuscular system and making sure that we've got the correct muscles firing at the right time, restoring proper movement, and then reprogramming, putting it all together as to create a solid foundation for movement. And we're going to go through the other 3 stages of the rehab strategy in other talks. And today we're going to focus on the issue of improving tissue elasticity. One of the things in this 4-phase strategy for recovery is you have to kind of go through each step in the right order, because if you don't have the proper tissue elasticity, you're not able to balance your body. And I hope that that becomes very apparent to you today during the talk. So we're going to discuss Lisa Bentley, who is an amazing person, and her challenges in dealing with a chronic Achilles tendon injury as an example of how to improve tissue elasticity. The theme of the week is move enough, but not too much. Okay, so Normally, throughout our daily lives, microscopic injuries occur in our muscles, tendons, ligaments, and bones. Proteins will age, they become damaged, and they need to be replaced. So in this cartoon, you'll see that a muscle fiber may become damaged with daily activity. And then at night, with proper rest and nutrition, cells will go into the area, they'll remove the damaged tissue, and then another group of cells will come in and actually repair the injured area. And this is what I mean by the rhythm of recovery. The problem is we can lose this rhythm when tissue damage accumulates, where we have more damage than the body is able to repair in that night. And we won't notice any effect from this in the first day or two or week or two, but these accumulative changes progress over months, years, and decades. And what happens is, as we have these areas in the tendon that are damaged, it changes the suppleness or the elasticity of the tissue so that the tissue doesn't respond to movement, and the area actually becomes more vulnerable to mechanical overload. For any of you over the age of 20, you may notice stiffness in your muscles, in your joints when you get out of bed in the morning. You may feel some ropey areas in your muscles. You may find that you're losing motion in your joints, and this is an indication that you've probably lost some of the elasticity and the suppleness of your tissues. So one of the key things and key messages I want to share with you today is that it's important to have elastic, supple tissues in order to maintain a foundation for movement. So today what we're going to do is we're going to review a number of things that you can do at home to keep your tissues supple. Lisa Bentley. Lisa is a really, truly remarkable individual. Not only is she an amazing athlete, she's an 11-time Ironman champion. She's just one of the most inspirational human beings that I've ever met. And I'm really thrilled to say that next week, she's going to join Eric and I to talk about the other component of the relax phase, not the physical component, but the emotional and the mental side of recovering from an injury. But today we're going to focus on how Lisa dealt with a chronic Achilles tendon injury. She suffered from this for quite some time. And I met her in, I think, May or June of 2007, after she just finished competing in the Australian Ironman competition. And for those of you who don't know, Ironman is an incredibly physically taxing event. It consists of a 2.4-mile swim, 112-mile bicycle stage, followed by a marathon. And when Lisa was in her marathon stage of the Australian Ironman, her Achilles tendon became too painful and she had to walk to the finish line. So I met her at this point, and I learned a lot about Lisa. And one of the things that really struck me was an amazing situation is that she suffers from cystic fibrosis. Lisa was diagnosed with cystic fibrosis at the age of 20. And this is a genetic disease that affects your lungs and your gastrointestinal tract and makes people vulnerable to recurrent lung infections. So when I met Lisa, she was in her late 30s, and she had been able to train, compete, and be successful in such an incredible endurance event with dealing with cystic fibrosis. To me, was remarkable. One of the things that I believe made Lisa vulnerable to recurrent overuse injuries was the fact that she had these recurrent lung infections, and she had to be treated with an antibiotic. And at the time, I don't think that it was as well known, but certainly we do know now that a group of antibiotics, the fluoroquinones, are associated with tendinopathy and change the matrix of your tendon and predispose you to tendon degeneration. So Lisa had been treated with ciprofloxacin on a number of occasions, and this is a factor that did help to predispose her to her Achilles tendon injury. Now, this is a picture of Lisa's heels, and you can see when I met her, I was helping her with her right heel, but here she actually has a problem with both. And you can see that there is thickening of the Achilles tendon. The Achilles tendon is the tendon that attaches your calf muscle, the gastrocsoleus muscle, to the calcaneus or heel bone. And so every time you push off or point your toe, you are engaging the gastrocsoleus and Achilles tendon complex. And Lisa has a slightly different type of Achilles tendonitis than the classical area where you would see a thickening in the center of the tendon. She has what's known as Hagdorn's deformity and disease, which is where the Achilles tendon actually inserts directly on the bone. So there's not only changes in the tendon, there are actually changes in the bone itself. And this happens when there is overload of the tendon where it inserts on the bone. And in Lisa's case, combined with the antibiotic use, led to a breakdown and a loss of the rhythm of recovery. So she would have the little fibers in her tendon tear, and her body wasn't able to keep up with the recovery process. So what we see here is hypertrophy, or a significant thickening in the tendon itself. And that's the body's response, where it's trying to distribute the load over a greater surface area. And in addition to this breakdown of the tendon, there is associated inflammation. So what happens is that the tendon becomes very thick, it becomes adherent to adjacent tissues, and non-pliable. So when I see someone like Lisa, I want to identify what the root cause of this Achilles tendon breakdown is. And we identified that her glutes weren't working very well on her right side at that time. This resulted in a tight hamstring and tight calf muscles, because they would have to compensate for the lack of gluteus maximus and medius muscle working. And if you remember the visual from last week of the rope that is frayed, if you have tension in your muscles and tight muscles, what that does is actually increase the tension on the rope. So she has increased tension on the muscles along the back of her body, which is going to put more stress here on the Achilles tendon. When I examined her foot, you can see that she has pronated flat feet. So that tells me that the little intrinsic muscles in her feet aren't awake and they're not working well to support her foot. And she had stiffness in a number of the joints in the foot. And the foot's quite a remarkable part of our body. There's actually 33 joints in the foot itself. And all of these little joints have to move and position themselves so that you can walk, run, and move effectively. And you can imagine that if you lose motion in some of those joints, another part of your body has to compensate. And Lisa's Achilles tendon is where this compensatory changes were occurring, and again led to an overload of her tendon. So out of interest, we have an x-ray here. This is looking at the side of Lisa's foot. These are the toes, and this is the heel. So this is where the Achilles tendon would insert onto the heel bone, which is called the calcaneus. And you can see that there's this piece of bone on the heel. Normally the heel would be fairly flat here. And so in response to the repetitive pulling from the Achilles tendon on the bone, she's actually made new bone. And so this kind of complicates the situation because we've got changes in both the bone and the tendon. Now, one of the things that leads to this poor tissue pliability in the Achilles tendon is that the inflammation in the area, and if we're looking here at the Achilles tendon, so this is again the side of the foot, just like we were looking at the x-ray. Here's the toes, here's the heel, this is the tibia, the leg bone, and this is the calf muscle and the tendon coming down to insert onto the calcaneus. And you can see here this is a little bursa, and a bursa is a small fluid-filled sac that is located between areas where there may be friction. So we often find them between tendons in the skin. We find them between tendons and bone, so that the bursa is there to protect the tendon. And normally the structure is very thin and there may be just a little tiny bit of fluid, but it's not a big piece of tissue. And if you actually take your thumb and you move it over your heel where your Achilles tendon inserts, you'll feel the skin moving across the tendon. But in Lisa's case, this didn't happen. The inflammation in the bursa here, and in an area what we call or deep to the tendon where there's a fat pad. We don't see the fat pad here, but normally there'll be a piece of fat that also helps the tendon to glide. The fat pad and the bursa had become adherent to the tendon. So what happens now is that this tendon is captured and the tendon can't slide like it normally would when you bend and straighten your ankle. And so there is even more force that is going along across this tendon, leading to more tendon breakdown. This is an important thing to understand because when we're focusing on treatment, one of the goals is going to be releasing the tendon, let it out of jail. We've got to release the fat pad and we've got to release the bursa from the tendon so that that tendon can glide and slide and move the way that it normally does. Another important factor when we're thinking about tendon injuries and how we can rehabilitate them is we have to know where Lisa sits on the spectrum of wear and tear for the tendon itself. So we have at one end of the spectrum some damage to the matrix, but overall the integrity of the tendon is there. All of the collagen fibrils line up. And then at the opposite end, we have a complete tear of the tendon. And I know that Lisa doesn't have a complete tear of the tendon because I would be able to feel a defect. And then if I actually stress the muscle and squeeze the muscle, her foot wouldn't move because there's no attachment between the muscle, the tendon, and the bone. So Lisa's pathology falls within this partial tendon injury where we've got this mixture of healing and breakdown occurring. Excuse me. So we're faced with a situation where we have tissue that's very stiff and non-pliable. And I kind of equate this to like a piece of beef jerky. And you can imagine that our goal is to restore balance. And if our goal is to recenter the ankle and the body and to get this circle centered back so that we're moving efficiently, it's going to be very difficult to do if you're trying to pull on a piece of beef jerky. So really, before we can start any of the goals of achieving alignment, balance of soft tissue, and using the correct muscles, we have to make sure that the quality of the tissue that we're dealing with is hydrated, supple, and strong. So in order to do that, Lisa went through a lot. Here you can see her, she looks like a porcupine. There's probably about 20 acupuncture needles. Dr. Scapatici, who's a very talented chiropractor. I've worked with Scap for many, many years and shared a lot of patients. He's very, very good. And so what he's doing here is not just trying to torture Lisa, but he is inserting these needles in points to change the biology in the area, to decrease inflammation, to allow the therapist and Lisa herself to get those tissues sliding and moving across one another. So she had acupuncture, she had active release therapy. I was involved with Lisa with performing injections. I learned a very special technique of injecting homeopathic remedies into injured areas from Dr. Müller-Wohlfahrt in Germany, and brought this to Canada, unfortunately only temporarily because we weren't able to get the technique approved through Health Canada. But Lisa was able to benefit from the use of these injections. And these injections, again, the goal was to promote sliding of the tendon by releasing it from the fat pad and the bursa, and to decrease inflammation. Lisa also made sure that she was eating well and had an anti-inflammatory diet. And you can do all the therapy in the world, you can do all the exercise in the world, but if you're not giving your body the proper building blocks for recovery, to get in there and to repair the damaged tissue, you're fighting a losing battle. And I think hydration is something that is highly underrated. It's amazing to me, actually, how important hydration is. And in speaking with athletes over the years, I've asked them, what's the key for your recovery? Someone who's played a really long, heavy tennis match, say, and they're going to have to go out and compete again the next day. They all say hydration, hydration, hydration. And then activity modification. Lisa was at a point where she could barely wear a shoe. There was too much pain with the pressure on her heel. So she became a big fan of Crocs. She wasn't able to run. And we talked a lot about modifying her training program so that she wasn't overloading her Achilles tendon insertion, but she was able to keep up some cardiovascular training. Now, in my mind, the most powerful tool in creating a healing response in your tissues is motion. And it's important that we understand the difference between active versus passive motion. Active motion is when you actually move the part of your body yourself, versus passively, it's somebody else doing the movement, or you relax your muscles and then you take your limb through the motion. The reason that active motion is so important is that it creates signals to the muscles and how to activate or to relax. And we'll review that again in the next slide. But here, what I really want to emphasize is that when you move the part of the body, you're giving direction to the cells in the tissue. So if Lisa were to flex and point and flex her ankle, she would be pulling on the Achilles tendon, and she would be giving a message to the cells in the tendon and how they had to line up and how they had to secrete the matrix molecules so that they could function best. Because our body responds to a load and it responds to the movement stress. If you don't move, then what happens is the cells get confused and they don't really know what to do. And so then they secrete the matrix and they secrete the collagen fibrils out every side of their cell. And you end up with this lump or glom of healing tissue that is very disorganized and not mechanically very strong. And I actually use this principle for my post-operative management of patients. So when you're doing surgery, we're actually creating a wound that has to heal. And say, for example, in the shoulder, if I was fixing an unstable shoulder, I would tighten the ligaments, and I would look at the time of surgery to see where the most tension was on my repair. And I would immediately have the patient start moving after the operation, just short of where they were going to stress the suture line. So this would be telling the cells how they were expected to be lined up and where they should be secreting the collagen fibrils. And I found that people recovered very quickly because they didn't have excessive fibrosis or scar tissue, and their repair was strong. Now, using the principles of active versus passive motion, we can really help to loosen the tissues along the back of the leg. So Sherrington's law basically says that when you activate a muscle, the muscle on the opposite side of the body and the muscle that would be doing the opposing action has to relax. So when you point your toe and you're using your gastrocnemius and stressing the Achilles tendon, you are relaxing the muscles at the front of the calf, the tibant. And then the opposite occurs when you activate your tib ant and your toe extensors and you pull your foot up towards your head, you're creating a signal that is sent to the gastrocnemius muscle to relax. And so this is a very powerful tool to help relax tight muscles at the back of the body and to send that signal to the cells within the tendon of how they need to line up the healing tissue. It's also important to consider the degree of pathology within the tendon. So if you have very minor damage within the tendon, so the overall structure of the tendon itself is intact, or the muscle, whatever part, the bone, it could be any one of our musculoskeletal tissues. But if the majority of it is intact, you can stress it with more load than if you have a larger tear. And the key here, and this is what really highlights the principle of move enough, but not too much, is you want to move enough to stimulate the healing response. But if you move too much, you're going to tear that healing tissue, and then you're losing your rhythm of recovery. You're creating damage, and then you have to start all over again. So if you have, and these numbers are kind of arbitrary, I've just made them up. They don't, they're not really scientific loads, but it's just to underlie a principle here that if you've got a 10% tear of the tendon and you load it with 5 pounds, the tissue can tolerate that and it will stimulate that healing response. If you loaded it with 10 pounds, that may be too much and it will create damage and tearing and breaking of your healing bridge, and you lose your rhythm of recovery. If you've got a 60% tear in the tendon, you may be only able to load the tissue with a 0.5 pound to stimulate that healing response so that you get what you want. And if you load it with 5 pounds, again, you're going to break the healing bridge and you're starting all over again. So having an understanding of how much damage is there in the tendon, how much load can I apply to the tendon, is very important to establish your rhythm of recovery so that you're not always creating more damage, but you're promoting a healing response. And that's where move enough, but not too much, comes into play. So Lisa went through a pretty intense 68 weeks phase of the relaxation principles. And then she was allowed to progress putting load onto the tendon. She didn't run for 2 months at all. And her first run was only 12 minutes. And I'm sure that for her, though, at that point, it was a thrill to be able to run pain-free. But the problem is that Lisa wants to run a marathon after she's already biked for 112 miles and swam for 2.4 miles. So it's definitely a victory, but to get Lisa to the end game can be really a challenge with managing the volume of training that she really needed to do in order to compete. But this is what we're going to talk a lot about next week, and that is sort of where you are emotionally and dealing with being off of your usual routine, not being able to do the usual activities that you usually do. And I think we can all relate to that right now. We're all kind of in this situation with COVID, stuck in our homes and not able to go out and do what it is we love to do. And so next week, we're going to talk about some principles that we can do from an emotional standpoint to help ourselves sort of refocus and where our focus should be. But Lisa, she really needed to go and race and for her soul. And so she decided that she was going to compete in the Ironman Championship in August. And, she really wasn't sure what was going to happen when she entered the race. And we're going to hear more about this from her next week. But it was really quite a miracle. She won the race. And, she said afterwards that, geez, this wasn't my best time. And I maybe wasn't the fittest that I've ever been in my life, but I felt the healthiest. And after that race, she really wasn't sure what she was going to do. And she was in some pain. You can imagine she kind of jumped up the top of the performance pyramid pretty quickly without having had a chance to really induce a good healing response in her tendon. And she was, you know, she really wasn't quite sure what she was going to do, but Lisa's very involved with the cystic fibrosis community, and she'd been in touch with a family. And this is, in this picture here is Carter, and he's a young cystic fibrosis patient. And I guess Carter's mom had emailed Lisa and said that, you know, Carter's dream was to run across the finish line of an Ironman championship with Lisa. And, you know, she's got to run the Ironman in Hawaii in October. And I guess Carter's mom applied to Make-A-Wish Foundation, and they were granted, Carter's wish was granted, and Lisa couldn't refuse, you know. So even though she was still kind of recovering from her injury and working hard, she said, okay, this is something that's bigger than me and bigger than life, and I'm going to go and I'm going to help this child to have his dream. And Lisa actually was doing extremely well. She was feeling very good going into the race. And she had a really unfortunate incident. This picture here, you're probably thinking, what is that? And this actually isn't Lisa's arm, but she sent me a picture of her arm, and this is what I recall. She was resting the day before the race in her hotel, and a giant centipede bit her. And I had never heard of these Hawaiian centipedes, but these things are like monsters. They're, you know, they're 7 inches. I couldn't put a picture of one of them up here because it was just so gross. But Lisa, unfortunately, was bitten. And these centipedes secrete a neurotoxin, which can lead to muscle cramping. And Lisa was affected with some GI upset, and she had to stop 12 times during the race because of this. And really what kept her going was Carter. And this is a picture of Lisa and Carter just at the finish line. And Lisa calls this picture the touch. And it's usually kids and people with cystic fibrosis don't actually touch each other because of risk of infection. But this was just such an amazing moment, and for me, a touching moment of how Lisa, even though she wasn't able to compete and win the Ironman championship, she really is a winner in my mind for the gift that she gave to Carter. So Lisa's really, I can't wait to talk to her more about this next week. So what can you guys do when you're at home and you've got an overuse injury? You realize that you've got some non-pliable, stiff, inelastic tissue. What can you do to help yourself? So I like to use a combination of ice and heat. Heat to warm up the tissue before you're going to try to mobilize it, and then ice afterwards to decrease any inflammation that may have occurred through your activity. I promote active self-myofascial release. So this is trying to get the tissues gliding and sliding. And we go in this order of kind of warming the tissue up, and then the self-myofascial release to get the tissue sliding before we try to activate any of your muscles with isometrics. Because if the tendon or the tissue is stuck to the fat pad or to the bursa, it's harder to get the mobilization that you want. So you go in the order of releasing the tissue, using a vibrating foam roller or a vibration plate can also be really helpful in changing the nervous system, changing the quality of the tissue. Again, your anti-inflammatory diet and hydration are things that you can't neglect. And then once you're fed, you're watered, you've got your released the tendon or the muscle from the adjacent tissue, you then actively move your body through a range to direct the healing response and gain length in those tight tissues. Today's talk has really been all about the relax phase, and that's preparing the tissues to restore motion and restore the proper neurologic firing patterns. But one thing that I think is really helpful to do if you have an injury is to look at the other areas in your body. And what I mean by a distant site is, for example, with Lisa, she had the local injury of her Achilles tendon, but then she had an issue with how her glute was firing and her core strength, and she had an issue with the foot and the toes. So what you can also do while you're relaxing the tissue in the injured area is start focusing on getting the right muscle firing patterns in the hip and in the foot. And this is really important because one of the most common reasons that people fail in recovering from overuse injuries is that they get the tissues to heal, they get the tendon to heal, they get mobility in that area, everything looks good in the ankle, but then they've neglected why that part of their body broke down in the first place. And so then when they start to get back to their activities and they start running more or playing tennis, whatever their activity is, the tissue is going to become overloaded again because the glute isn't firing properly. The hamstring and the gastroc will get tight again. The foot isn't moving properly. So all that stress is going to go right back onto the area that you're having trouble to get to heal. So it's very important. And I think it's really great from a mindset standpoint to focus on an area that it doesn't hurt because it makes you feel good because you're really seeing more gains quickly. So I hope that today I've been able to teach you some things about restoring or maintaining a rhythm of recovery by moving enough, but not too much. And it's important that you do these activities short, frequent amounts throughout the day. And this is because the cells need to kind of be reminded frequently. So you're better off to do literally 15 minutes in the morning, 15 minutes at noon, 15 minutes at dinner time versus 45 minutes in the morning. So this can be done daily to help improve your tissue quality. And I think that if you can try and incorporate some of the principles of these relax phase tools into your usual routine, even if you're not injured, then you can help your overall recovery so that you don't get injured in the first place. And I like to use some of the exercises that we do for the relax phase as a warm-up and or warm down from whatever sport or activity that you're engaging in. And I think that the older we get, the more we have to focus our training on keeping the tissues supple, keeping the tissues of good quality. So when you're 15, 16, 20, you recover quickly. Your body doesn't really lose its elasticity as quickly as when you get into your 30s, 40s, 50s, and 60s. So you have to change how you train so that you're focusing more on maintaining good quality tissues. So next week, we're going to focus on the second part of the relax phase, which is relaxing the mind. Our beliefs are probably the most powerful healer or injury producer that we have. It's probably one of the most interesting things that I've observed over my 30 years of being a physician. And it really is what people believe will happen to them. What they believe about their injury, what they believe about their treatment will come true. And we are really, really privileged to have Lisa join us next week to discuss these concepts and to teach you some tools that you can take home to help you deal with any injuries that you may be suffering from. So that's all I have for the formal part of the presentation, and would love to hear your questions.
Awesome. Thank you. Thank you so much for presenting that, Dr. B. Really appreciate the time that you're taking in putting these together. It's, they're very structured, they're organized, and it's taking people from kind of point A to point B. So I hope that people are sticking with it through the end, because if you're understanding this stuff, it's going to really benefit you for the rest of your life, the rest of the life, that your active life. If you're choosing to be active, this information and this knowledge is really going to help. One kind of little tidbit I wanted to share on the last slide that you had there, and then we'll get into the questions. There's a few in here. But there's always a story that I like to share from a study on that, the beliefs and the mindset. And it's a study from the World Journal of Surgery. I think I mentioned this at some point before, but they were testing chemotherapy drugs. And it was a fairly big study with maybe 200 and some odd participants. And there's Livia poking her head in there. It was a fairly big study, randomized, double-blind, placebo trial. And they had 3 groups. One group had drug A, one group had drug B, and then one group had no drugs. So this was back in the 80s. So I don't know if this would be allowed to do now, but studied the people for a while, and then they took response, and then they looked at the data afterwards. And what was interesting was the group A and group B, which had chemotherapy drugs, they looked at alopecia, which is hair loss. And there was a significant amount, maybe 50% or so of the people in those groups had lost their hair. The interesting part was the people who were in group C that basically had the placebo, 30% of those people also lost their hair. So what do people think about when they're going under chemotherapy and cancer treatment? It's one of the most obvious symptoms and signs is hair loss. So these people didn't have any treatment, but still the 30%, which is a very significant number, experienced that hair loss. So I always like to share that one because that one's straight from the research. I can maybe pull the study and throw a link in the description, in the YouTube description as well.
Yeah, it's so true how powerful the mind is. And we'll elaborate on all of this next week for sure. But it's the one thing that if I was able to influence anything with a patient, I would hope that I could influence their beliefs by education, through education. And I think that this is one of the things that I think when people understand what's happening inside their body and they can appreciate and feel and sense that what they're doing is creating this healing, it has a double effect because the beliefs and their emotions can then contribute to the healing. And that's where, the quote that I put there that I say that being emotional about healing doesn't help, but the emotions can help your healing. And so I'm very excited to talk about this and hear Lisa's experiences next week.
Yeah, as am I. Based on her bio and what you've told me about her, she sounds like a phenomenal human and somebody that we could all learn a lot from.
Yeah, for sure.
Okay, so we're going to jump into some questions. And one more thing before we did that, we just added a bunch of links to the description because as you were detailing Lisa's issues and the compensatory kind of possibly root causes to the actual injury, I was just kind of looking through the YouTube channel where we could throw some stuff at people. So you'll find some stuff for tight hamstrings, which is a lot of activation of other muscle groups. We've got glute activation exercises in there, overpronation video, Achilles tendonitis stuff in there. So tons of additional resources for people to look into. If you have an Achilles issue and you're thinking, oh, that's me, what do I do? Here's some other things that you can do in addition to treating the Achilles itself.
Yeah, it's excellent. Actually, Eric's exercise programs, what I really like about them is that they use the principles that I've described today. And that's why they're so powerful. So if you are having any foot and ankle issues, please look at the links below. I forgot to mention that, but they're excellent, excellent exercises.
Cool, thank you. So let's get into some questions. And we're going to start with one here. Mrs. Sekali is here. Says, hi, Dr. B.
Hey, Susanna.
What's your position on plasma therapy, aka PRP, that seems to be growing in popularity in the US as well as here in Canada?
Okay, well, that's a great question. So the whole point of PRP, plasma, stem cells, these are sort of different injections that are gaining in popularity, is to promote healing. They're we're hoping that what we're doing is injecting growth factors into the area to promote healing of the tendon. So I think that there can be a real role if you've got, say, a partial tear. I think if you've got a very tiny little tear and one that'll heal on its own, I don't think it's necessary. But for larger defects in the tendons, I think they can be very beneficial. The big issue I have with all of these treatments goes back to my talk last week, which is that you have to get to the root of the problem. So say you inject a growth factor into the tendon. And actually part of what we were doing with Lisa was injecting materials to try to decrease inflammation, decrease fibrosis, and help with repair of the tendon. But that's only one facet of the treatment. You then have to look at the primary movement problem and fix that, or else when the individual is feeling great and then they go back to running, what happens is that the body just breaks down again. So you can use it as an adjunct to changing how you move.
Right on. So that's just kind of, it's similar to, better than, but similar to painkillers, in that when I tell people about painkillers, yeah, that's helpful if you're in so much pain and you can't move and you just need to be able to walk. And if it allows you to do that, then that's good. But it's a Band-Aid. You're not addressing the root cause, you're addressing symptoms. So you always need to go back to the root cause and think about, okay, what led to this issue in the first place? And with the body, it's typically some kind of compensation. So something else is just not working right, something else, and then another muscle or tendon or joint is taking that load and doing more than it should or more than it's designed for. And then that is the thing that breaks down. So just looking at the thing that's broken down, you're missing the main root cause. And it's gonna, even if you fix the thing that's broken down and it feels better, something else will compensate. So you'll go, might be instead of your knee bothering you, now it's your low back bothering you. But the issue was a hip issue at the root cause. So that's one thing that I often say in all of my articles, and I target specific issues when I'm writing about the article, but in that article, it's always it's almost like a disclaimer. It's like, yeah, this stuff is going to help, but at some point, especially as we get older, it's probably makes sense because you're not going to kind of be the detective and find that one muscle that's not working. And, once you do an activation for that muscle, all of your problems are going to go away. It's just a matter of there's so many compensations layering on top of each other over years and decades of moving with things not working properly. You just have to go to every joint, restore tissue quality, range of motion, build up strength and endurance and movement patterns everywhere. So that's kind of the disclaimer. And people hate hearing that stuff, I find, because everybody wants the 6-pack abs in 6 minutes type thing. But that's the game that we got to play if we're looking for movement longevity.
It's interesting. My daughter Hannah, she's 25 now, and she just got home from university, and she's out and she goes, "Mom, I just want to be active and do fun stuff." And she trained for years. She played competitive tennis at Williams College, and it was pretty rigorous. They're training 3-4 hours a day and all her studies. And so she's like, "I just want to have fun." And so she's been going out and running, and then she gets out of bed. She's like, "Oh my God, I'm so stiff and I'm so this and that." And I'm just like, I can see all these compensations developing and all the, I'm like, it's so challenging to impress upon her that if she just did a little bit of activation and tissue pliability exercises now, she'll be running forever without having a terrible wear and tear injury, but it's not really the fun stuff. Now, it's weird. I like doing that stuff.
Yeah.
Like everybody teases me. Everybody teases me, it's like, cause I'm in the gym for 4 hours before I play tennis and 4 hours after. It's like, oh my God, like, do you have everything else to do in life? But I guess I really enjoy the fact that the difference I feel in my body and the effect it has on my performance. And I don't like being in pain. So
Mhm.
It's that's where I get the joy from, and I just find it really fun to learn, and then I'm able to teach everybody else better as well because I experience it.
Mhm. And that's one reason why I think it's important for people to have either a sport or to continue to challenge themselves in the gym, because as you push yourself, you're going to learn where your limitations are. And then if you want to get past that point, that's when you're going to have to go back and learn what you need to do to get past that point. And it's not just about pushing harder or doing more. It's about changing how you're moving and how your body's functioning so you can naturally progress over that, whatever that limitation or plateau is. So I think it's super important to be active either in sport where you're pushing yourself and being a little bit competitive, or in the gym and, you know, trying to get a little bit stronger and make some gains there. So you have something to teach you what you need to do to get better.
Agreed.
Yeah.
Smarter training. True.
Yeah,
It's really,
definitely. Okay. Questions. Anti-inflammatory diet. Andy J has asked this. Can you give more information about that? So what are your thoughts on that? Some quick guidelines or
Okay, so basically, I'm not a nutritionist, but from reading and speaking with lots of patients and my own personal experience, basically it's shop around the outside. If your grandmother doesn't recognize it, you don't eat it. Lots of fruits and vegetables. Fruits and vegetables have the natural phytonutrients or antioxidants and molecules that help build our immune system. So I eat lots of vegetables, and you have to. It's very personal. Like there are some people that when they eat, say, they call the nightshade vegetables, they have an inflammatory reaction, whereas I personally don't. So I think you have to kind of experiment a bit about this, but I believe in a balanced diet. I think that it's really important to eliminate sugar. Sugar is probably the most inflammatory thing out there, but you're going to get your natural sugars from your fruit. I think a combination of good fats, carbohydrates, and protein. Now, when you think about some of these fad diets where, you have all protein, no carbohydrate, or no fat and all protein, I don't think that that's the way our body was made. I believe in kind of moderation, and that our system needs all of these components in order to function well. These days, our food sources aren't necessarily as healthy, so I try to eat local, so that I'm eating an apple that hasn't been on a truck for 4 days and frozen 10 times, so that it still has good nutritional value. And you may wonder, like, what I think about supplements, and do I feel that we need to supplement? And I think that it's probably important, but I've got to say I still kind of struggle with the whole supplement industry. It's kind of like the Wild West, and you have vitamins and proteins and supplements that are in a pill form, and they're not coming the way that we were meant to get them in that exact combination of, okay, you're eating an apple and you've got X amount of sugar and X amount of water and X amount of fiber. And all of these things together, I think, are what really help to promote good absorption of the nutrition so I would love to hear from other people and their experience. There's a lot of very good supplement companies out there. But I really think that at this point, my biggest promotion will be to eat natural, everything in moderation, and make sure that you include all of the food groups, with a little bit of a heavier emphasis on fruits and vegetables.
Mm-hmm. Yeah, I completely agree on pretty much all of those points. Whole natural food, fruits and vegetables, meat that, I get my meat from a farmer who I've been getting meat from this guy and his wife and their farm for, I think, He told me I was their longest customer. So I think I've been maybe 16 years, 17 years I've been getting my meat from him, most of it. So I think if you could find that stuff and find a farmer you can develop a relationship with and that you know is raising animals in a healthy and humane way, I think that's great for not only your health, but the environment and kind of karma and all that stuff. But yeah, Daniel Gallucci, Dan the Brain Man was on here. We've had this discussion about supplements and we're all on the same page, which is pretty cool, because he's on the neurology side, you're an orthopedic surgeon, I'm a movement guy, and we kind of have the same beliefs and thoughts about all that stuff. So I would say it's the 80-20 rule. If you're 80% of your results are going to be from your diet and the food that you eat. And then to get over that point, maybe there's some supplements that can contribute. But if you're supplementing on a diet that's full of sugar, refined foods, processed foods, then those supplements aren't going to do anything. They won't be beneficial at all. So,
one of my goals during this COVID crisis is I'm actually going to start a little vegetable garden on my back. I have this little balcony off my office because I have too many rabbits. I think if I try to grow some lettuce in my backyard, that the rabbits are going to eat them. And I don't know how green my thumb is, but we'll find out. But I was thinking, if I could at least grow my salad, that might be kind of a really good way to have great nutrition, because talk about fresh.
Yeah, awesome. Yeah, that would be cool. Hopefully COVID ends by the time the harvest comes and I can try some of that.
Yeah, that would be great.
Okay, let's get to another couple questions here. Andy has another question, and this came from the slides, but can you give more information on what relaxed phase tools are? And Andy, I was checking, and if you go back to this video after we're done, minute 35, you'll see the slide where Dr. B lists the various modalities that you can use in the relaxed phase. One follow-up I wanted to make to that is something that I've personally found helpful that is related is pretty much every night, even if I haven't done a hard workout, but especially when I've done a hard workout, in the shower, I just do contrast shower on whatever joint I feel would benefit from that. Typically my knees. Those are the ones that get achy if I'm running hard or squatting heavy or anything like that. So I'll just do 30 seconds as cold as possible, humanly possible. My tap, I just put it to full cold, 100% cold. 30 seconds on the knee, then 30 seconds as hot as I can stand without scalding myself. I do that 3 times, and then that's it. And I find that really, really helpful for immediately after in the way my knees feel. And then the next day, I don't have any of that residual ache that's kind of more joint related as opposed to muscular related.
It's funny you do that, because actually I do the same thing, but I do it more on my thigh muscles. Like if I've had a really intense tennis match and I've been out in the heat for 3 hours, and then I know I got to get out and play again the next day, I go in and I do that hot, cold contrast. And I agree, it's very beneficial.
So something to add. And at first you might be a little squeamish in the cold, and like
it's not fun.
Yeah, but once you breathe through it, you'll get, the first one is the worst. It's like jumping into a cold lake. You just got to jump in. You can't just walk slowly into it.
So do you want me to review all of those things for Andy, or?
I think it's okay, because they're all listed there. Yeah.
Okay.
Go to minute 35, give or take, and you'll see the list of it on the screen in the presentation as well as the discussion. So let's see. I think let's go to that question from Colin from last week. Last week's Ask Dr. B, and it's around shoulder tendons. If a shoulder tear is not a total rupture, but significant, can you rebuild total tendon strength with the right tendon loading program?
Well, the short answer to that is yes. And it's interesting. Over the years, I've seen partial thickness tears of a rotator cuff tendon, for example, heal. But a lot of whether the tendon will heal depends on the success of the individual in establishing the rhythm of recovery. It also depends on how partial is the tear. Is it 10%? Is it 50%? Is it 80%? It's much harder to get an 80% tendon tear to completely heal. However, We do know that tendons adapt. So just a lot of what we've talked about and is the fact that a tendon will respond to load and to movement. So sometimes what happens is that even if the tendon itself doesn't heal, the remaining tendon fibers will hypertrophy, they will become stronger, they make more collagen fibrils. And so the tensile strength of the tendon itself improves, even though there is a defect in the tendon. So yes, you can promote healing of rotator cuff tendons with the appropriate load being applied at the right time.
Cool. Okay. And you would be the person to know that better than anybody, I think, with your background in dealing with shoulders and lots of rotator cuff tears with the baseball, the Toronto Blue Jays.
Well, you know, the fascinating thing is we would see, you don't always see changes on an MRI, but because my surgery list was so long, I had a 2-year period where I would send people off to do exercises. And if they had tears, there's like the intrasubstance tear. So if you went to the spectrum of wear and tear, that would be a tear in the middle of the tendon, just like that. Those very often heal. Partial tears that are on the surface of the tendon, if they're smaller, 10, 20, 30%, often would heal. Once the tendon tear got over 50%, it was hard for it to heal completely, I believe. However, people would become pain-free. And so this experience that I had watching the response to movement really has influenced me and my approach to wear and tear injuries.
Yeah, definitely. Got a couple more questions. You still have a couple minutes here, Dr. B?
Sure. Where am I going? You know, walk the dog, maybe.
Yeah. Okay, we have a question from Go Yankees. How can I get fluid?
Oh.
Yeah, arch nemesis. How can I get fluid off the knee joint besides getting it pulled out by needle?
Okay, so getting fluid pulled out by a needle, yes, it works, but also if you're not fixing the underlying problem of why the fluid developed, it'll just recur. So we don't often just drain a knee unless it's so tense and painful. So getting the fluid off of your knee, this is a really good question, and you need to get you need to really focus on the relaxed principles. And Eric and I actually have put together a course for meniscus tears under Avoid the Knife, which goes through all of the principles. So you ice to decrease inflammation of the lining of the joint itself. Then you follow this by gentle activation of the quadricep muscle and specifically the VMO. And that's a part of the quadricep muscle. We train you how to waken that up. And what I found is that patients who had a knee scope, I would go into the recovery room and I would teach them how to activate their VMO and fire it up right away. And they would get less swelling. And then when you get less swelling, you get less pain. And when then you get less pain and swelling, your range of motion comes easily. And so then when you have good range of motion, your muscle can go through its usual length. So it becomes a very positive cycle. So what you have to do is also temper, though, how much you're walking on your knee. Because if you remember the slide of the tendon where you've got, like, say, the 60% tear of the tendon, and if you load it with the ½ pound, you're fine, but you load it with 5 pounds, then you tear the healing tissue. Well, it's a similar concept with your knee. Your knee is vulnerable for whatever reason right now, and it's reacting to a load by swelling. So you have to decrease the load that's being applied to your knee by resting, by modifying your activities. So I'm not sure, from your question, how much activity you can do before your knee swells, but let's say you can walk without your knee swelling, but when you try to run, your knee swells. Then what I would do is only walk right now, do the ice and get your muscles firing properly, and then address the issues of why your knee is swelling in the first place. So that probably has something to do with your hip and your ankle. So that's kind of a complicated answer, but it will allow you to have the swelling go down, then the muscles can be activated more effectively. Then you can build your strength. And then what you can do is you can start trying to introduce running, but don't go and run 100 miles in your first day back. Walk for 100 yards, run for 20 yards. Walk for 100 yards, run for 20 yards. And then see if your knee will tolerate that load. And if it does, if your knee doesn't swell, then you can progress slowly over time. So that once you build your strength and you've identified the movement issue as to why your knee is swelling and you've corrected that, you should be good to go.
Okay, cool. There's a couple comments as you were talking here from Go Yankees. Thank you. I've been doing yoga for 6 months and cannot sit back on my heels. Is there a way I can work into it?
Oh,
well, actually, yeah.
Yeah, I know exactly what the answer to that one is. Go ahead, Eric.
I just did a live workout session. So I call it mobility strength, but we did it on meniscus. It was like advanced movement and activation patterns for the knees, and specifically that I used for my meniscus issue, that where I shared an exercise, which is basically exactly that, being able to sit back on your heels. And the way to do that is through active means. So what Dr. B was talking about earlier, active versus passive movement, this is taking that into your direct issue. So if you search our channel, the YouTube channel, for meniscus and just look, it's maybe 2 weeks ago, I think. I have no sense of time nowadays, but it was within 2020. But search for that and you'll find that technique, as well as a bunch of others to restore knee flexion, range of motion. So Go Yankees was also saying it was an MCL tear with a quadriceps graft. So any additional insights based on that info?
Sorry, an MCL tear?
Was
there an ACL, MCL? Because usually the quadriceps graft would be for an ACL. I'd probably need a little bit more information, but if that was an ACL that was fixed with a quadriceps graft, the quadriceps, if they took the graft from her quadriceps area, then there may be loss of pliability of the tissue right there. So you're going to want to focus on releasing your quadriceps tendon with some active self-myofascial release and all the things that we've discussed today. Eric, maybe you can point her to some, I think your exercise video that we've already mentioned is going to be perfect for this. Really, it'll help to change the tissue pliability in your distal quad.
Yep.
Where they harvested the graft.
I think so. Yeah. The comment I was laughing at is maybe it was the ACL. So
okay.
we're not sure.
Okay,
but either way, it was 10 years ago. So that video with those exercises,
that'll help a lot, because it's likely that there's residual scarring and loss of elasticity of your quadricep tendon there where they took the graft.
Yep. Cool. I think, okay, so there's one more question. Cindy, thoughts on Biodex tests?
Biodex. I don't know. I'm not sure exactly which. Is this a strength test? I'm not 100% certain which.
I'm not sure what this is either. I think it's a very specific testing protocol with equipment. It might be Isokinetic.
I think it could be Isokinetic strength testing.
Okay, yeah, it is Isokinetic strength testing. You know what? I'm not super familiar with the protocol. All it says is Isokinetic. But I mean, that is I would say just from an injury perspective, if you're injured, that is not really the place to start testing, the velocity of movement, of isolated joint movement. The picture is of somebody doing a leg extension, doing this test.
So I think some of the Biodex, what you can do is you can control the load so that through the whole range of motion, the load is maintained in the same way. So every range, you've got the same load on the tissue, which can stimulate a healing response, but it can also it'd be a challenge because we're not meant to have the same load on the joint or the tendon throughout that range of motion. So I think it depends how much load is being applied. And I would prefer that you've kind of maybe not stress the tissue in quite in quite that way until you've got a better foundation for movement. The other way of using the Biodex, I think, is for speed. So you can control the speed or the load. But really what we're talking about at this point is getting that quality of tissue to the point where it will tolerate a load. So this may be something better down the road, Cindy.
Yeah. And I would say, even from a performance perspective, there's been plenty of, because you can only do isokinetic with single joint isolated movements, I believe, with this methodology. So from a sports performance perspective, if you're at that point where you're trying to improve performance, then you're looking more towards movement patterns. So squats and squat jumps, or just whatever jumps, as opposed to like a fast leg extension or a 90 degrees per second leg extension. So if it's from an injury perspective, though, I'm not sure on the value, and I don't want to comment on it, but I do think that the movement perspective of restoring natural movement through the full range and being able to control that, so that the appropriate load is at the appropriate angle, is from my perspective is going to likely be more functional and more natural for the body to respond to. So, okay, thanks for the question, Cindy. I think there's one more. Where was it? Oh yeah, Susanna, what are the best and worst activity sports for post-rehab meniscus? Of all that is out there to support and maintain knee health, what would be the top 3 recommended by you?
Okay, well, I think that you need to start. So let's assume you've got your foundation for movement. You've got a good alignment, you've got good balance around the knee, and you're using the correct muscles with control. Then when you're going to start back to activities, I think that you should be doing linear type of activities. That means you're running in a straight line or you're riding a bike. And I prefer building load gradually. So I would start out cycling, I think, can be great. Swimming can be great. Rollerblading, skating, things where you're kind of going in a straight line, where you're not twisting, turning, and changing direction. So you want to test the knee and build endurance and strength in the system that way. And then once you've gotten comfortable and you're feeling good and you've built some strength, then you could add lateral movement, so side to side movement, and eventually add twisting movements. So there needs to be a progression. So I would choose your favorite linear activity, what makes you feel good and what makes you happy, as your go-to exercise to return to. And I also think variety is important, that if you can have a little bit of variety, then you're stimulating your muscles in a slightly different way, so that the same part of the muscle, or the same part of the tendon, or the same part of the joint is not continuously and repetitively being overloaded again and again.
And I'll add to that in terms of activities and sports, just from a personal insight, is I find that playing recreational sports, sometimes not too competitively, the example here is hockey. If I'm out playing shinny hockey at High Park, or just the outdoor rink where you can go play, and there's just 8 of us guys out there, I'll stay out there the whole time for maybe an hour or 2 hours. And then after those sessions, my knees are cranked because I haven't taken any breaks. Whereas if I play normal ice hockey, I'm going out there for 1 to 2 minutes, then I'm taking a break on the bench for a minute or 2, and back and forth. So I think it's important to, if you've got knee issues, to be aware of the duration of loading as well, not just the direction or the other intensity, but duration of loading. So getting the breaks in there just to take that load off can help to support knee health and to support feeling better the next day. So just something to be aware of when you're, depending on what activity you're choosing, something to think about.
I agree with that comment for sure.
Okay, so I think that wraps the questions.
Okay.
There we go. Episode number 2 of Ask Dr. B Live is in the books. So everybody, thank you very much for joining us. We're here Thursdays at noon Eastern. So please come and join us. Make sure you subscribe so you're notified of when this comes on and you don't miss it. And next week, what are we talking about again next week, Dr. B?
Next week, we have Lisa Bentley joining us to discuss the relax the mind aspect of our first phase of rehabilitation. And I can't wait.
Yeah, I'm really looking forward to meeting Lisa as well. This is going to be fun.
Yeah, she's awesome.
Okay, so
all right.
thanks
everyone.
again. Have a great day, and we will hopefully see you next week. Take care.
Bye.